Hey everybody, this is Dr. Serrano, and I'm the founder of Ignite Chiropractic Wellness and Blueprint Family Health. And this is the Ask the Doc series. And what I'm doing here is I'm taking some of the top questions I've been asked over my career. I've categorized those, and I'm answering those right here for you, almost as if we're having a conversation. So today's topic is chiropractic. I've organized them and categorized the questions. So let's go. Number one, the question is, what does the chiropractor actually do? And for me, that's a loaded question because there's so much that's happening with a chiropractic adjustment in a chiropractic office. But I'm going to explain to it from what we do in our office as simply as possible. In our office, what we do is very simple. We're trying to connect the brain to the body. We're brain body chiropractors. Well, and all that means is this. Hey, for you to function at your best, you want your nervous system, you want your brain and nervous system functioning at its best. Because at the end of the day, for your heart to beat, for your lungs to breathe, for your stomach to digest food, for any cell, tissue, or organ in your body to actually function well or optimally well, it has to be connected to your brain. If there's any disconnect, any miscommunication between the brain and the body, then guess what? That's when disease can start setting into place. That's when organs start to not function the way they should. That's when systems start to function less than what they're capable of functioning and or doing. So at the base of what we're doing, what does a chiropractor actually do? We're connecting the brain to the body better so that you and your family can heal and function better and thrive to whatever potential God put inside of you, right? Like we want you guys to live into your potential. So that was number one. Number two is this. What actually happens with an adjustment? Well, with an adjustment, we're reconnecting that brain-body connection. But how do we do that? Like, what are we actually looking at? So when we're looking at a patient, there's several things that we're taking into consideration. Number one is this. Are there any reflexes happening in the nervous system that's causing asymmetry? Right? Because if I'm looking at somebody's posture or spine or nervous system, and I'm seeing that one side's tighter than the other, that's a signal that the brain is trying to protect an area or not communicating well with that area. Right? If I'm looking at somebody's laying down and I'm looking at their feet and their feet are not even, that's a signal from the body that there's something off with the brain-body connection. And we, as chiropractors, we got to figure it out. What is happening? Is it a pelvis that's on level? Is there an area of the spine that's out of alignment, not moving properly? It's causing almost like static between the brain and the body. And once we find that, then we do very light adjustments to those areas to reconnect that brain-body connection better. And it happens all the time. Every time we see this, we have somebody who's laying there. We adjust their spines. A lot of times I like to do the show and tell with parents, right? I'll look at their child's feet, and I can see that they're out of alignment. And I'm looking down, and all of a sudden, I'm like, "Do you see how short this foot is? Watch what happens when they turn their head to the left, and it evens out. Watch what happens when they turn to the right, and it gets uneven." And I explain that's because there's something in the brain there's something in the body that's affecting the nervous system. Typically, it's a bone or a spinal segment that's not moving properly, and it's causing the brain to react and to protect that area. You never want to be in protection mode. Protection mode means that the body has some level of strain or stress. If there's strain or stress on the body, that means that the brain's picking that up and it's not functioning the way it optimally could be functioning. So when we find those areas, we adjust those areas, and immediately those reflexes relax. The brain gets a better connection with the body, and that body starts to heal and function better. Question number three, pretty simple on this one here. What actually happens when you pop or crack the neck? Like, what is the popping or cracking? And to be honest, let me say this first. Not every adjustment is a pop or a crack. You don't hear that every time. Sometimes they're very light adjustments just to trigger the nervous system of the brain enough to relax. Now, in some cases, there is a cracking and popping. When that happens, it's just gas leaving the joints. So yeah, guess what? Your joints, they're gassy. Question number four is chiropractic only for back and neck pain? And this is a tricky one because although that chiropractors are great at helping people with back pain or neck pain, I look at that as like the tip of the iceberg. Right? When you have an iceberg, and you're looking at the tip, you know that underneath the surface, there's a whole mountain of ice. When you're looking at the tip, that's what back pain or neck pain management by a chiropractor would be, because I believe that there's so much more happening below the surface to the nervous system, to the neurotransmitters in the brain, to the way the body's functioning when you have consistent and regular maintenance chiropractic adjustments. There's so many benefits that are happening that you don't even see or feel. And that's why when you just talk about neck pain or back pain, it really kind of diminishes what you're doing when you're going to get an adjustment. And question number 5, the last one here is, how is chiropractic different than massage therapy and or even physical therapy? And the way I like to explain this is really simple. When you go to physical therapy, I think of it like you're working with the muscles. You're stabilizing things. You're getting things back through full range of motion. When you're going to a massage therapist, you're working on the body from a different perspective, looking at, hey, is there fascia that's like not moving properly? Are there muscles that are just chronically tight that we need to help relax and get them moving again? Right? When you think of chiropractic, I want you to think about the connection between the brain and the body. And if there's any interference between that connection, you know that that body is not functioning the way it can and or should. So that was today's episode of Ask the Doc series. And those 5 questions were answering chiropractic and what do we do in our office as chiropractors.